job. Thank you all for coming tonight. Really excited to have all of you here to have this update on what's going on in the world post-Roe v. Wade. And we have Larisa Mendez Downes here to speak with us. She is the head of Advocacy at Planned Parenthood, and she is also the president of the Fair Lawn Democrats, right? That is Fair Lawn Democrats. So without further ado, Larisa, take it away, and then I'll give you more instructions about how to do the postcards.
Thank you, Beth. Thanks, everybody, for having me. As Beth said, my name is Larisa. I'm the director of Advocacy at Planned Parenthood in Metro New Jersey. Some of you may remember me from my work with Moms Demand Action for Gun Violence in America, which, what is it? It's Moms Demand Action for Gun Sense in America. And as you can imagine, it's an intersectional issue, actually, because who ends up being affected the most is usually our Black, Brown, Indigenous, and Latin communities. So tonight I'm going to give you a little bit of an overview on the abortion access landscape. Talk before that a little bit about Planned Parenthood's legacy and the legacy of medical discrimination in the U.S. And then we're going to talk a little bit about what's going on in New Jersey. So, as you probably know, Margaret Sanger founded Planned Parenthood, or at least the organization that would become Planned Parenthood in 1921. She actually started her first birth control clinic in 1960, but the organization that would become Planned Parenthood, she did in 1921. She was actually a nurse, and her background was that her mother had 18 pregnancies. She was one of the 11 children that survived because 7 of those, either pregnancies or early infancy, those children died. And so that founded a lot of her beliefs and her push to get birth control into wider use, particularly for underserved poor communities. Now, she did eventually come into alliance with the eugenics movement, which is in direct opposition to our mission, which is that we believe that all people of every race, religion, gender identity, ability, immigration status, and geography are full human beings with the right to determine their own future and decide without coercion or judgment whether and when to have children. And so, even though she eventually distanced herself from the actual eugenics movement because of its explicit turn to racism, she did speak at a KKK rally for political expediency, and she also endorsed the 1927 SCOTUS decision of Bell, which basically ruled that states could forcibly sterilize people deemed unfit without their consent and often sometimes without their knowledge. And so that acceptance of this decision by Sanger and others laid the foundation for tens of thousands of people to be sterilized, often against their will. In fact, during her time, several states had state-funded agencies within their government for sterilization purposes, for exactly this reason. And so, of course, this is not the only type of medical or repro rights discrimination that we've had in this country. The so-called father of gynecology, J. Marion Sims, experimented on enslaved women, and without anesthesia, even though it was available when he was operating. And that was because he had the belief that Black people didn't feel pain the same way that others folks did. So if you can imagine having surgery anywhere, but certainly down in a gynecological area without anesthesia. The first contraception trials, too, the first birth control trials in the 60s in Puerto Rico with the pill were actually very high levels of hormones, and they were given to poor women, often without their consent as to what kind of levels there were in those, and about the severe side effects that those pills at the time had. And this was followed by years of forced sterilization of poor women, and it wasn't uncommon in other states, particularly, as I mentioned at the top, Black, Indigenous, and Latino women. And as we saw during the Trump administration in 2020, there was actually also forced sterilization in ICE centers in Georgia. So with that legacy, here we are in a post-Roe world in which we know that discrimination and racism continue to play huge parts in our healthcare system. Let me walk you to the pre-Dobbs era, which was less than a year ago. So this is where we are with pre-Dobbs. And so the pink highlighted states there are states that we deemed at risk pre-Dobbs. So what does that mean? It meant that those states, yes, on paper, abortion was legal throughout the United States, but in many of these places, there were all kinds of restrictions, whether it was gestational, so number of weeks. In some places, you had to have a 3-day waiting period, which, as you know, is incredibly ironic in a country that usually doesn't have waiting periods for guns, but you have a 3-day waiting period. Vaginal ultrasound in some cases, in other cases counseling that had to accompany the ultrasound. It all really depended on the state, but at least it was acknowledged on a federal level that there was a protection of abortion. So, June 24th, Roe falls, and this is sort of where we are right now. So, 18 states we currently consider to have either complete and total bans or very restrictive access to abortion. So, for example, you can see all of the dark areas. That is where abortion is completely banned. The red areas is where abortion is severely restricted, if not already existing attempts to ban it entirely. And then the lightish pink areas have some restrictions. We'll talk about Kansas in a little bit. And then the lighter areas are where there are more open, progressive laws about abortion. Before I move on, I want to use the example of Indiana next to Illinois, and Illinois also bordering that Midwestern southern curve down there, southern Illinois. Indiana passed a total ban on abortion last summer. But Planned Parenthood, ACLU, others fought that. And so while it works its way through the courts, it is still legal, although severely restricted. I believe it's restricted to 10, 12 weeks, maybe around the first trimester, maybe not even as far as the first trimester. Regardless, it's incredibly restricted. But if you need an abortion in Indiana, you need to go to Illinois, ideally, or in Missouri, Kentucky, Tennessee, Arkansas. And by the way, Tennessee has the most restrictive laws in the country. There is no exception for rape or incest in Tennessee. So if you are a 13-year-old, a 12-year-old that's been raped and is pregnant, you have no choice in that state. But again, I want you to look at Illinois. Illinois basically is where most people in those black and red states would try to get to if they could drive or go to get an abortion. However, as you can imagine, Illinois is facing capacity issues because everybody from that Midwestern area and those southern-facing states will try to go there first if they can. But you're on a ticking time clock at that point because if you're pregnant up to now, 10 to 11 weeks, you are going to be relying on mifepristone and misoprostol, which is the two medicine protocol for a medication abortion. And a medication abortion is actually the most common type of abortion used in the United States. If you're then past those 11 weeks, or 10 and a half weeks, it depends on the provider and how sure you are of your period. So that's why it makes it a little bit harder to gauge. Where are you going to go, right? And we're talking about, and particularly for Planned Parenthood, folks who are already facing multiple barriers. So Planned Parenthood's patients are usually under the poverty line, up to like 150% under the poverty line. So you're talking about someone who may be working multiple jobs, who probably doesn't have vacation or time off. Most people who get abortions in the United States already have at least one child that they're trying to provide care for. And so then you're asking them to try to get to another state, where in that area, and then not only try to get to another state, but again, will they be able to take time off work without getting fired? Do they have transportation needs? Do they have child care? Will they have to take their child with them? All of these questions are sort of what we're dealing with. Now, Planned Parenthood and others have funds that folks under these circumstances can take advantage of if they know they exist, right? And that is, there's a national network fund, national network of abortion funds throughout the United States. And if you get in touch with those folks will try to help you as much as they can. Many of those funds, including PPM&J's abortion fund, will try to, if a person needs transportation, if a person needs hotel, will try to provide those. But getting folks to make that call, if they can get through to a call center, to then finally get those answers, also requires a level of, do I know to reach out to these services, right? And that's not necessarily always the case. So, okay, and of course, I'm sure you've all seen the MIFI issue right now. So mifepristone, as I said, is a drug that since about 20 years ago in the United States has been used in that two-part protocol that I talked about in terms of medicines that are used to induce an abortion. Usually only for about 10 to 11 weeks. That was approved in 2016. Prior to 2016, it was 7 weeks. And so it's because it's had such a long history of efficacy and safety, in 2016 the FDA felt it was good to move it to 10 to 11 weeks, as I said, depending on medical person's determination on where the pregnancy is, gestation-wise. So a group of anti-abortion activists basically cherry-picked a judge in Amarillo, Texas, and this is the U.S. District Court of the Northern District of Texas, Matthew Kaczmarek, who was a Trump-appointed judge, who had written previously on his views against gay rights, against abortion access, birth control even, and he ruled in favor of the plaintiffs, and in fact used some of their anti-abortion language. In spite of the fact that, again, based on the merits alone, and this has never happened in anything that the FDA has approved to this level, 20 years of safety and efficacy here in the United States, and another 20 years before that in Europe. And so the DOJ immediately appealed to the Fifth Circuit, and that decision upheld part of the injunction and overruled the other part. So it upheld everything before 2016. So the, we're not going to take it off the market, but you can only use it up to 7 weeks, which, many folks who have periods, it's not always incredibly predictable. It's not necessarily, you may not know that you're pregnant or not. You might be late because you just had a death in the family or whatever reason. At 7 weeks, you may not know that you're pregnant. You may not even be in that mind space. So everything after 2016, they said, no, you can't do that. Again, questioning the FDA. So DOJ made an emergency appeal to SCOTUS, and Alito issued a temporary stay, which was a temporary stay until last night, but now was moved to tomorrow midnight. So we should have some kind of idea. It honestly makes me a little bit worried that this wasn't immediately thrown out, because the FDA has 40 years of evidence that this is a safe and efficacious drug. Now, what would happen if they decided to take mifepristone or Miffy off the market? You can go back and do a 2-day protocol of several packets of misoprostol, but meso, while safe and effective, has usually stronger side effects. So if we're talking about you are inducing a miscarriage, the person who is having basically a miscarriage, an abortion, by medication is going to be having more days of cramps, is going to possibly be experiencing more nausea, and is going to be experiencing more discomfort. And again, to sort of step backwards to what I said earlier, at least in terms of Planned Parenthood and the folks that we get at our health clinics, we're talking about people who probably don't have sick days, right? What if they're undocumented? Or they don't have vacation days or childcare. And, you know, if anyone's ever had a flippin' terrible period, you know that it can be basically crippling. You can be in bed for days. Now imagine doing that for 4 days if you're trying to just get through an abortion, basically. So that's kind of what we're dealing with right now. And part of, to quickly go back to this and then just sort of loop in that Miffy ruling, that would potentially also affect even states like ours, right? Because the FDA is a federal agency, so it would be pulled from us as well. And that's a tool that, you know, because of its efficacy, because of its safety, our organization and so many others use around the country. And it adds to this incredible dystopia of where can I go for my health care? Where can I go to get these services? Miffy is also used to treat miscarriages. And so if, in many cases, if you experience what is called a missed AB, it means that your body has basically, you know, the fetus isn't viable anymore, and your body basically has had a miscarriage, but it's not expelling the fetus. And so what that means is that, and this has happened in Texas and other places, we've heard about it in Texas, I'm sure it's happening elsewhere, but what essentially happens then is that you're told by a hospital that understandably doesn't want to take on the liability to go home and wait until you're septic. Because if they give you the 2-step protocol, then they are potentially opening themselves to lawsuits of having provided an abortion. So again, imagine yourself as potentially a low information voter or a person who's already trying to manage kids, possibly more than one job. You're probably living under the poverty line if you're coming to one of our clinics. What are you going to do? I mean, I think about this often and I just think, my God, the desperation. I can't imagine. Now, pulling back even further, apparently, this was a bigger issue than many on the anti-abortion side thought that it would be. Because if flippin' Kansas was, you know, which we wouldn't on any scale call blue, decided in its August referendum, which, by the way, was placed in August so that it would have a low voter turnout, if they overwhelmingly defeated an amendment that would take away bodily harm, or bodily autonomy, that would take away bodily autonomy from their state constitution, then, and we saw it play out in November, it meant that abortion and what people think of with bodily autonomy, so freedom, the right to make your own decisions, was a bigger deal than even a lot of pundits gave credit to. I think we were all expecting a huge red wave. We did not get a huge red wave. And so talking about Kansas referendum specifically, our former president, Cecile Richards, said it's about more than abortion, it's about whether the government has the ability to take away your freedoms. And I think that really resonated, particularly because we've seen over the last 7 years that have felt like 100, that people have equated that idea of democracy and choice to abortion. Interestingly, the Kansas referendum actually very closely mirrored what Americans, when polled, say about abortion. So the Kansas referendum was, I believe, around 57% and this is what part of what made this whole vote just so crazy, was that it was purposely designed to sound very confusing. So the no vote was what the pro-choice folks wanted, and the yes vote to repeal was what the antis wanted. So the folks who voted to keep the amendment were something like 57%, and the folks who voted to take it away was something like 37%. And that actually very closely mirrors the United States. In general, the United States at large, based on polls, so, take it with a grain of salt, 61% favor abortion in some way or another, that it be legal, and just about the same, 37% favor banning abortion entirely. I may be wrong with the Kansas yeses on those, but it's around that area. Maybe it was 41%. But regardless, it very closely mirrored those Kansas numbers. So, what's happening here in New Jersey? In New Jersey, Roe was basically codified, just very simply, because we've had great law precedent supporting and keeping abortion legal that I think, according at least to our legal folks and legislative folks, would have probably stood up against any kind of push against it. But just in case, sort of reading the room, Phil Murphy and the legislature passed the Freedom for Reproductive Choice Act at the beginning of last year. So that was 2022. Yeah, that's right. Okay. So in 2022, passed the Freedom for Reproductive Choice. That basically just codified Roe. We had wanted certain insurance guarantees for abortion, more help for undocumented folks because they face particular barriers when trying to access abortion. Because even for Planned Parenthood, for example, the way that we try to provide aid to those who can't financially afford, whether it's an abortion or an annual exam or something, is a sliding scale. And so you prove with a pay stub or whatever how much you make, and then based on that, there's a whole elaborate chart. You go down and you go, okay, you pay $20 then for this procedure. But if you're an undocumented immigrant, chances are you don't have those documents, or B, you don't want to provide whatever documents you do have in case you see it as a danger to yourself and your family, right? Especially given the last couple of years that we've had with immigrants being, deported and whatnot. So, New Jersey, safe haven state. What does that mean? It means that our state passed legislation to protect itself against the fall of Roe, which happened 4 months later. It also means that we've passed laws, although to my knowledge they haven't been tested in the courts yet, to protect our healthcare providers who provide that type of healthcare to folks coming in from other states. It also means that folks coming in from other states, their medical records can't then be extradited to another state. That hasn't been challenged legally yet, but those laws were passed, I want to say shortly after Roe fell last year, because I remember wearing shorts around the time. And why do I have an arrow here going to New Jersey? Well, before Roe fell in September of 2021, Texas passed what we call a bounty law, which basically was that they were offering $10,000 for turning in folks who had helped to provide help to someone getting an abortion. That could be somebody who drove your Uber to the clinic. That could be your mom, your cousin, your brother, whoever drove you or took you or helped, give you the $50 you needed to make ends meet to get that abortion, was liable to be sued under that abortion, anti-abortion law. And so within days, we had one person who took advantage of the hub connections that airlines have, and I believe hopped on in Dallas. I'm not sure about that, but it was a hub. And they came to Newark Airport because Planned Parenthood Metro has 2 Newark locations. And we have Montclair, Patterson, and East Orange. They came to Newark, and long story short, we were able to help them eventually, but part of the issue goes back to what I was saying earlier, which is that person had the time and the money. I mean, they had to go back the next day, which was a little bit, they ended up staying a little bit longer. But again, 2-day protocol, if they had taken that second part of the protocol back in Texas, right, would that have opened PPMNJ to liability? Would that person now be doing something illegal in the state of Texas? I mean, these are all questions that she eventually was fine. She stayed an extra day in New Jersey, but again, she had that resource, right? She came with a partner. She had a hotel. She was able to book a flight. That is not always, and most usually not always, the case. What we also say in New Jersey, though, is that Roe was the floor. That is, Roe is literally the least that can happen. And I was at Seton Hall yesterday making a very similar presentation to this, and one of the students asked, well, could federal legislation be passed to at least just codify Roe? Which I think, if you remember, a couple of the House representatives before the midterms tried to do. Planned Parenthood did not support that, as the ACLU and others didn't, because it was very much for this and other reasons I'm going to talk about, but it's an access issue, right? Roe was the floor. It was literally the minimum. And Roe wasn't even decided on women's reproductive freedom. It wasn't decided on social justice for women. It was decided on an issue of privacy, right? That was the clause that the men who were on the Supreme Court at the time, and that was what the lawyers who fought for Roe used as their tactic, because they knew they were going up against 9 men who had never been pregnant, much less had a period in their lives. And so that was why, well, I told the student who asked, the way that Congress is right now, that's not, I mean, we couldn't even pass the Violence Against Women Act, right? Which up until recently has had bipartisan protections over and over. And the reason that it didn't pass was that it had protections for domestic partnerships, so not necessarily married domestic violence issues, but for to cover the so-called boyfriend loophole, which allows folks who are in boyfriend, girlfriend, whatever, in relationships to seek help when trying to get guns away from somebody who might do harm to themselves or others, in that case, the partner. And so because it had that tiny little provision there, right, even though in the United States, women in domestic violence situations have a 25 times more likelihood of being killed by a gun because of our prevalence of guns, that didn't pass. So we can't even pass that. We're not going to be passing even Roe at the federal level as things stand. So in New Jersey, yes, Roe is codified. We have been very lucky that the current governor has been incredibly open to working with pro-abortion legislation, supportive of family planning, which if you remember during the Christie administration, family planning was entirely pulled from Planned Parenthood and the Family Planning League. That cost a ton of jobs, and then what lack of jobs in health clinics means is limited access to health services, right? And so what we continue to deal with in New Jersey is incredibly awful maternal mortality rates and infant mortality rates, particularly for Black women and for Black infants. And so we are ranked 47th in the United States in terms of our maternal mortality rates. We are ranked right along with Georgia, Arkansas, yeah, pretty much, Mississippi, Alabama, all of those. And interestingly, we're sort of the exception to the rule, which is that in places that have greater access to abortion care, to reproductive rights, and that type of health care, actually the maternal mortality rates are better, as in they're lower, as are the infant mortality rates. Why is New Jersey the worst for Black women? Racism. We have a lot of urban areas that have been neglected. We've got a very populous state, and so time and time again, those disparities in income and equity come to bite us in the ass repeatedly and often. The other thing that we're constantly working on in New Jersey is stigma. I mean, if you think about even the stigma that we still have as a culture towards periods, right? We don't necessarily have them pads or tampons in bathrooms for our kids, for our girls. Planned Parenthood is the first place that I've ever worked where I don't feel the need to hide a tampon as I'm going to the bathroom, right? Like, so we still have a very cultural stigma around periods. So imagine if we have that around periods, what it is around abortion, right? And sort of the cultural mentality that we have around who gets an abortion. Why are they getting an abortion? Oh, well, you can have an abortion if you've been raped or the victim of incest, obviously, but you shouldn't get an abortion if you already have a kid. Or why didn't you use birth control? We have a huge stigma around it, where we don't often see it. Although maybe we do see it because look at all these anti-abortion legislations that we've been having. And then we continue to work on in-state policies and laws to address disparities. Like I said, access particularly to communities that are undocumented, Black, Indigenous folks. It's still a huge disparity. Not to mention, if you remember at the top of the presentation, the justified distrust in the medical system that up until recently, and still does, discriminates very much against Black, Indigenous, and Latin folks. I often use the example of Serena Williams, who had a very tough birth, and I believe that her husband was a great advocate, but this is a woman in peak physical condition who has a ton of money. Arguably, you'd think she'd have recognition and power, and she had a hard time during her birth of her daughter. The other thing we're fighting, and I'm sure this is also a thing here, is inclusive and comprehensive sex health education and the push against, inclusivity in boards of eds that say that, people are teaching pornography at kindergartens, which is ridiculous. If you look, and if you have a nerdy moment in your busy lives, if you look up the actual sex health curriculum, it's very much, kindergarten to second grade. If it's included at all, it's something like, hi, my name is Larisa. I'm a female, and I think that everybody is great. It's very inclusive and very sort of like, I'm sure that's not the curriculum, so don't quote me verbatim on that. But it's very much just about like, this is me, that's you, this is my name, I want to be inclusive, let's be friends regardless of our differences. it starts very basic. And it's not until you get into later grades like middle school and 8th grade that you even start talking about, gender and identification and all of the stuff. And even then at that level it's consent, or at the kindergarten level, oh, you know what? Oh no, don't touch. That's not your body, so let's keep it here. The things we want our kindergartners to do. Don't bite Bobby on the playground. That should really carry on towards, safer sex, consent, and inclusive and comprehensive sex health. And that's getting pushed back. And of course, as you know, the trans youth are under attack around the country. Somebody say they were just recently in Florida, DeSantis country with the don't say gay and trying to ban drag queens in Tennessee. It's just not great. So, New Jersey and PPM&J. So, Planned Parenthood has actually 2 affiliates in New Jersey. We have Planned Parenthood of Metro New Jersey, which is where I work, and Planned Parenthood of North, Central, and Southern New Jersey. And then we have the Action Fund, and if you get alerts from Planned Parenthood, that's probably where it's coming from. The Action Fund, that's like, go to Trenton, write in a note to your legislature. That's the Action Fund. What we do is I provide advocacy for our health centers that basically provide all of this. Annual exams, birth control, emergency contraception, medical abortion, in-clinic abortion referrals. That means that the 11 weeks post-procedures that are aspiration, there's actually no surgical or surgery involved. Those we refer out because we have good relationships with clinics around the area. Pregnancy testing and counseling options, STI testing, HIV testing and counseling, PrEP services and counseling, and gender-affirming hormone therapy. We're particularly proud of the GAP program, the gender-affirming hormone therapy, because that is actually the only Planned Parenthood in the state that offers that to 18-plus folks. It's based on an informed consent model. That means that you don't have to come in with, referrals or recommendations from a psychiatrist, from a doctor, whatever. You come in, you're making those decisions yourself. And we have a patient navigator dedicated entirely just to that, as we now have in the post-Roe era, an abortion navigator for someone who gets the calls of, I'm in Tennessee, I don't know what to do, please help me. And that person guides them through all of the resources and whatever. And the literal, you're coming into the clinic, let me take you here, let me take you there, that type of thing. So I just kind of wanted to give you that a little bit because I think often, just to close it out, often Planned Parenthood, we get the protesters, and I was walking to a center in Shrewsbury, and somebody was like, think of the babies, as I'm walking in there, and I'm like, please tell that to the NRA. But, most folks actually don't realize that Planned Parenthood, and we're proud of the safe and effective abortion services we provide, but those are 3% of the services we provide. The rest of them is stuff like this, and we're often a one-stop shop for pre- and postnatal care for those folks who can't afford to go anywhere else for these services. So that does it for me.